Undetectable equals untransmissible is a public health campaign that was started a few years ago to help people who have HIV understand their risk of transmitting HIV to other individuals. If you have HIV and you are taking antiretrovirals, then you have a very low amount of HIV in your blood. You have such little amounts in your body that you can't actually transmit HIV to someone else. So the treatments that we use to make HIV undetectable are known as antiretrovirals, and these are medications that target the HIV virus. And they work in a couple of different ways, but the basic idea is that they find HIV in your body and they destroy it, and they destroy it at different parts of the HIV virus. Because they're working on different parts of the HIV virus and because HIV is so strong, what ends up happening is that you need a couple of medicines in order to actually get HIV undetectable. So that's why you'll see people taking 2 or 3 pills, or if they take 1 pill, that pill has 3 different classes of drugs in it. But antiretrovirals are the kind of magic medications that keep people undetectable. So the kind of most important thing to do if you are something known as a serodiscordant couple, which is someone has HIV and someone else doesn't, the most important thing to know is that HIV is in the relationship, that someone is infected. And then the second most important thing to do is to make sure that that person is taking their medications regularly. And if you ever miss some doses, you want to actually not have intercourse because unfortunately the risk wouldn't be 0 at that point. So there's this scenario that can happen, which is that someone is really, well controlled with their HIV, they're undetectable, but then they travel, they go home or they go on vacation and they forget their medication. And in that setting, it's important to understand that you don't want to have sex at that time because their viral load may be higher and they may be actually able to transmit it to you. If you are dating someone and you're HIV negative and you're not sure if that person may have forgotten some medication, or if you're just not sure, the most protective way to avoid getting HIV is to wear condoms. And so whenever there's any question, we always go back to that because for years we saw that individuals that wore condoms, even if their HIV wasn't controlled, did very, very well. So local public health bodies actually have, many of them actually have departments for HIV that are specifically dedicated to that population, and they will release recommendations of safe sex practices. But if you're wondering, the kind of easiest way to find out is to go online and to put in safe sex HIV, and you're going to get some patient advocacy groups that will be able to talk to you about it. And of course, you can always talk to your primary care doctor who will give you more information.